Welcome everyone to the statewide Medicaid Managed Care Long-Term Care Program webinar for long-term care potential network providers. This presentation is part of a series designed to teach you about the statewide Medicaid Managed Care Long-Term Care Program. In particular, this presentation will teach you about hospice and the statewide Medicaid Managed Care Long-Term Care Program. To access today's presentation, please follow the link below to the SMMC website. That would be AHCA.myflorida.com/SMMC. And select the News and Events tab under the header image. Note, you can also use the red button to sign up for SMMC program updates via email. Next, please select Event and Training Materials to download today's presentation. You may also view details regarding future SMMC events by selecting the Calendar of Events and Training. Last, choose the files you would like to save. Another note, you may also view files from past events and AHCA guidance statements or submit questions to be answered in future presentations. Now that everyone has had a chance to download today's presentation, let me introduce you to today's presenter. We have Beth Kidder with the Agency for Healthcare Administration. I will now hand you over to Beth.
Good morning. It's a pleasure to be here. My name is Beth Kidder. I'm the Assistant Deputy Secretary for Medicaid Operations, and I wanted to introduce you today to Claire Anthony Davis. Claire is a registered nurse who has worked for a number of years here in the Medicaid program, and she is taking over responsibility for hospice policy. So I'm sure you all will have the chance to interact with her in the near future. Today we're going to talk about the statewide Medicaid Managed Care Program, specifically the long-term care portion and how it relates to hospice providers. This is not intended to be a comprehensive overview of the long-term care program. If you want more details about the program, then the website that Jessica mentioned at the beginning of the program, AHCA.myflorida.com/SMMC, has a wealth of information, and I would encourage you to get familiar with the resources on that site. But just a brief overview, the statewide Medicaid Managed Care Program was authorized by the Florida Legislature in 2011. It establishes the Medicaid program as a statewide integrated managed care program for all covered services, including long-term care services. The program is in the process of being implemented statewide. There's a regional rollout. There are 11 regions that coincide with the existing AHCA Medicaid areas and the Department of Elder Affairs service areas. This statewide Medicaid Managed Care programs is changing the way that the majority of individuals receive most of their health care services from Florida Medicaid. As many of you know, there are two portions to the statewide Medicaid Managed Care program. The long-term care portion, which is what we're talking about today, we began implementation of this program in August of 2013, and we will roll out the last regions on March 1st of 2014. The Managed Medical Assistance Program will be implemented in 2014. We're awaiting federal approval of our implementation schedule, but we are proposing to begin a regional rollout of that program on May the 1st next year. Now, the long-term care program, Medicaid recipients who qualify and become enrolled in this program will receive their long-term care services from a managed care plan. The people who are eligible and frankly required to participate in the long-term care program are people 65 and older who need a nursing facility level of care. That includes hospice recipients residing in skilled nursing facilities. Another group is recipients 18 years of age or older who are eligible for Medicaid by reason of a disability and who need nursing facility level of care. There are 5 programs that are transitioning into the new long-term care program that are home and community-based service programs: aged and disabled adults, assisted living, nursing home diversion, and channeling waiver programs, and the frail elder option. The current recipients of these programs will be enrolled in the long-term care program without any interruption of services. That is one of our major goals of the program rollout, and so far has been extremely successful in all the regions that we've gone live with. Now, hospice recipients will be required to choose a long-term care plan if they meet one of the criteria to be in the program. So if a hospice recipient is 18 or older and residing in a nursing facility or receiving services through one of the home and community-based waiver programs that I mentioned, they will be transitioned into the long-term care program. And the long-term care program covers a number of home and community-based as well as institutional long-term care services. I won't go through all of these. Most of these are home and community-based services, but you'll see highlighted that hospice is a covered service. So if a person meets the criteria to be in the long-term care program and needs hospice services, it will be provided through that long-term care managed care plan. Now, it's important to note, an important note about dual eligible recipients. There are about 87,000 people in the long-term care program, or will be when it's fully rolled out. 95% of them are dual eligibles, that is, enrolled in both Medicare and Medicaid. And therefore, those individuals, if they need hospice, then Medicare is their primary payer, just as it is today. Now, there have been a number of questions about contracting with the long-term care managed care plans. Each region has a different set of long-term care plans. There are 7 total statewide. And each long-term care plan must offer a network contract to all the hospices in the region in which it operates. Hospices that are enrolled providers must participate in all the eligible long-term care plans in the region. So it's a mutual relationship. The long-term care plan must offer you a contract and you must participate. I'll go into a little bit more details about contracting with a long-term care plan. Providers have asked at times, when should we have a contract with the long-term care plan? You can choose to contract with a long-term care plan at any time, but some information about this is that recipients begin choosing their long-term care plans 2 months prior to the go-live date in their region. We employ through a contractor independent choice counselors who use a list of contracted providers to help their recipients choose a long-term care plan. So if you want to be on the choice counselors list of network providers, you need to have an executed contract with the plan, and the long-term care plan contract must be validated in a system that we call the Provider Network Verification System. So this takes a little bit of time, so it's best not to wait till the last minute to get your contracts in place with the managed care plans. If you have any questions about contracting with the managed care plan, we have specific provider contacts for each managed long-term care plan on our website, and there's details here about where to find that list with contact information, direct contact information. Now, there are some special provisions in the law about hospices and skilled nursing facilities that participate in the long-term care program. As I mentioned, for the first year of the statewide Medicaid managed care program, the long-term care plans must offer a contract to the Medicaid-enrolled hospices and skilled nursing facilities in each region. After the first year, plans can limit the number of providers in their network based upon provider performance, credentials, and price. Plans, however, do have to pay the skilled nursing facilities and hospices at a minimum the Medicaid rate. Medicaid is going to continue to set rates for hospitals and skilled nursing facilities just as we do now. Now, if a recipient chooses a long-term care plan that for some reason does not have a contract with the hospice or that skilled nursing facility, the long-term care plan and the provider need to work together to determine how to handle payment for the services. As I mentioned, the law requires that skilled nursing facilities and hospices that are enrolled in Medicaid must participate with the long-term care plans. What that means in practical reality is that you may not notify a recipient that they have to move because that facility or hospice is not contracted with the plan that that resident chose, or that you can't reach a payment agreement. Again, these should be rare circumstances because the plans have to offer you a contract. They have to pay you at least what you're being paid now under the Medicaid program. However, in the circumstance that you cannot reach agreement, you cannot require that person to move or to change plans in order to continue receiving services from you. We would consider that this was not participating in the program as required by the law, and if we determine that the facility or hospice, then all remedies are available to us up to and including disenrollment or termination for the Medicaid program. Now, we do have 2 different kinds of managed long-term care plans right now. We have health maintenance organizations, or HMOs, that are paid a capitated rate, and we have one provider, one long-term care plan that is a fee-for-service provider service network. That is American Elder Care. And it is a statewide provider. It operates in all areas of the state. To be paid by the fee-for-service long-term care plan, the provider must be fully enrolled in Medicaid. That means you must have an active and full Medicaid enrollment. For the other plans, if you want to be in their network, which, again, you're required to participate, and you are doing that with a capitated long-term care plan, you just need to be registered, a registered Medicaid provider. This is a shorter process. and there's a simple form for that. At all times, all providers must meet the Medicaid provider requirements at the time that the service is rendered. Now, nothing changes in terms of recipient rights or recipient appeal rights. The Medicaid-enrolled recipients maintain the right to disagree with any change in their services, that is, a reduction, a termination, or denial of service. And the long-term care plans are required to notify the recipients of their rights to challenge any such change to their services. During the transition period, during the rollout of this program, we have put a tremendous emphasis on continuity of care and ensuring that nobody's services are disrupted because of this move to a new program. The requirement for the long-term care plans is that they must continue their enrollees' current services for up to 60 days until a new assessment and care plan are complete and services are in place. And that includes that they should have the same services, the same providers, the same amount of services, and the same rate of pay. So this would include hospice services. If a current hospice recipient transitioned into the new program, you should be working with the managed long-term care plan to make arrangements for that, but we are guaranteeing payment through that long-term care plan for up to 60 days until a new care plan can be put into place. Again, that means even if you've not reached some kind of written agreement with the long-term care plan, they still have to allow you to continue services to that recipient, and they must pay you for that service. Again, they will continue to pay you the Medicaid rates. We'll say it again, hospices must be paid at least the Medicaid rate, and that is actually in the law, so that is something that will not change unless the law changes. Now, we understand that a number of the recipients who are hospice patients that are in the long-term care program are likely to be residing in a nursing facility. In that case, the hospice will bill the long-term care plan and then provide the skilled nursing facility with the room and board payment. I'll spend a little bit more time on this. There's been a lot of confusion on this point. This basically continues just as it is now. You receive the payment and you pass through the room and board payment to the nursing facility. The confusion around this stems from the fact that when the legislation was passed, it had different directions than this. However, the federal law states that it must be done this way with the pass-through from the hospice, and so the federal law trumps the state law, and this is how we have implemented it. So basically it stays exactly the same as it is now, that you will receive payment from the long-term care plan and then provide the room and board payment to the skilled nursing facility. Now, for a recipient who has Medicaid only, the long-term care plan will be responsible for paying the hospice provider from the first day the individual is enrolled with the long-term care plan. Again, all plans must reimburse the hospice providers at the established hospice rates, and we've posted the link. I'm sure you all are familiar with where the rates are posted, but in case you don't have it handy, this is the link to that on the AHCA portal. Okay, now there are some standards for timely payment of claims. For electronically submitted claims, the law requires that long-term care plans must pay or deny the claims within 10 business days of receipt if it's a clean claim. That is, all the information is included that is necessary to process the claim. They're also required to have a process for handling and addressing provider complaints concerning claims issues, and they do all have that in place. Now, the hospice claims will be submitted. This is really stemming from questions about how do you go about getting paid. That's something that you need to work on with each long-term care plan. The claims will be submitted to the plans based on instructions that are either in the contract or in a provider handbook or other instructions that they supply to their providers. They're all required to offer training to their providers on how to bill the particular plan. Just to kind of recap on reimbursement in terms of who to bill. If the individual has Medicare, then the hospices should bill Medicare for the hospice service, the levels of care for those dual eligibles. If they do not have Medicare and only have Medicaid, then they should bill the recipient's long-term care plan for the hospice services. And if they are only Medicaid, do not have Medicare, they should be billing the long-term care plan for the skilled nursing facility room and board based on the established room and board rates for hospice. These room and board rates, again, go ahead then and pass through to the skilled nursing facility. Now, if you are having any difficulty getting your claims paid from the managed long-term care plans, we will ensure that you are paid appropriately and timely, and And for help with billing issues, there's two ways that you can get assistance. The first is an online complaint form that we have. On our website, AHCA.myflorida.com/SMMC, that has all the resources about this program, there is a report a complaint button. And I apologize, I said it was red. It's actually the blue button on the website. That will go to a centralized complaint intake section in the agency, and a Medicaid staff person will call to find out more about your issue and to personally assist you with the issue. Another way is that you can call your local Medicaid office. The contact numbers are found on our website, and I've listed the link there. Those individuals, as always, would be happy to assist you with any concerns. Another aspect of billing is the share of cost, also known as the patient responsibility. The long-term care plan is responsible for collecting the patient responsibility for Medicaid services. However, if the plan and the hospice agree, then the hospice may collect the share of costs from the recipient. The plans need to make a decision about whether they will delegate that function to their providers or keep it, and it's an all-or-nothing decision. They can't have one provider collecting patient responsibility and another, the plan, collecting it. So most likely we expect that most plans will want their providers to continue collecting patient responsibility, as most of y'all do now. Now, there have been some questions about disenrollment requirements. Under our current managed care program, the regular medical program, if a hospice recipient is not enrolled in long-term care, but it is enrolled in a health maintenance organization or a provider service network, they will continue to be required to disenroll from that managed care organization upon admission to hospice. This has not changed. You'll still need to notify Department of Children and Families and your local Medicaid area office of the disenrollment by submitting the AHCA Form 5000-21. However, I want to give you a heads up that this will be changing when the Managed Medical Assistance Program is implemented in 2014. In that program, hospice is an included benefit in managed care, and it will no longer be required to disenroll. As we get closer to the implementation of Managed Medical Assistance, we'll be doing much more education about that. We've already started some overviews, Managed Medical Assistance 101, and I encourage you to go out to our website and take a look at that if you weren't able to participate in that webinar. So going on with disenrollments, if a hospice recipient is enrolled in a long-term care plan, the patient will not be disenrolled from the long-term care plan when they elect hospice. And then finally, as they are now, hospice patients still must disenroll from Project AHCA waiver when they elect hospice. That has not changed. One or two more slides to go. The last, one of the last topics is recipient eligibility. As you are responsible now, you are responsible for verifying recipient eligibility prior to rendering services and billing. You will verify recipient eligibility through the MEVS system, Medicaid Eligibility Verification System, and this includes the name of the recipient's long-term care plan. There is a detailed webinar on what to look for and how to check for long-term care plan eligibility. That is on our website, ahca.myflorida.com/SMMC. If you go to the News and Events tab and select Event and Training Material, you will see the eligibility verification training there. And then finally, on the topic of prior authorization, if you want to ensure payment, you must receive authorization from the long-term care plan before providing services. But that said, each long-term care plan will establish its own authorization process, and they will provide guidance to you just as they will for billing through the contracts and or provider handbooks. In addition to that, each recipient has a case manager, including recipients who live in nursing facilities, and that case manager is employed by the long-term care plan, and that person is responsible for coordinating the recipient's care. It would be advisable to contact the recipient's case manager to advise them of the hospice election and any help needed with obtaining authorization. There are after-hours contacts for case managers. There's always a case manager on call. And finally, I'll end with some additional resources, some of which I've pointed out already. We have a mailbox for questions that you have about the program. That's FL Medicaid Managed Care. at AHCA.myflorida.com. We do answer those questions either directly or by posting them to a Frequently Asked Questions document. The Frequently Asked Questions document can be linked from our page by clicking the gray Frequently Asked Questions box. Topics are arranged by subject, so there is a hospice section, and you can link directly to that section of the document. We do have updates about the program that we post on the website, and we have upcoming events and news on the News and Events tab. If you want to get an email notification of upcoming webinars or news or new information posted to the website, you can sign up for that by clicking the pink Program Updates box. And finally, AHCA is on YouTube, Facebook, and Twitter, where we post information about our programs, so we would encourage you to follow us on those mediums.